All right,
Good evening.
we're good to go.
Good evening, everyone. Thank you for joining us for the second of 3 community conversations. And we will be sharing our slides in just a moment. Thank you. So today's session is an opportunity for you to inform the strategic direction of the Department of Health and Human Services over the next 5 years. My name is Sumaya Clark. I serve as the Enterprise Project Administrator for the department, and I'll be serving as your moderator this evening. Next slide, please. I'd like to start with a few ground rules. At DHHS, we're committed to sharing information with you in a clear, respectful, and transparent way. We'd like for you to use the chat feature to share any questions, comments, or feedback that you have with us. But we also have an opportunity for you to share any additional thoughts or ideas that you have after this evening's session. And you can do that by accessing a link that's available at our county website, and we can share that in the chat with you as well. And now I'd like to introduce you to our Director Shakita LeGrant-McLean.
Thank you so much, Administrator Clark. And thank you everyone for joining us tonight. As Administrator Clark stated, today is our second community conversation. Last week we had a great conversation and we discussed basic needs. And we are so excited about hearing from you and your input of how we can meet the needs of the community that we serve. And tonight's conversation is all about our strategic direction. Where do we see ourselves in 5 years, and really having you at the table to help us to inform that. So for Department of Health and Human Services, our mission really is about empowering healthy and safe and meaningful lives. We have multiple divisions, so it consists of our behavioral health division, our disability services division, our housing, our division of youth and family services divisions, and recently our aging and our veteran services division. And so we really believe that together, not just meaning Department of Health and Human Services, but this is meaning our community, the people that we serve, our stakeholders, our providers, being at the table to help us to get to that through racial equity, we become the healthiest county in Wisconsin, which is our overall vision for Milwaukee County. And we do have our values are really, we call them our pride values. So as we look at our, our partnership, how do we partner with individuals? How do we make sure that we're showing respect and integrity, diversity, and excellence in everything we do? Next slide, please. And so here you would see this is our overall, the strategic focus areas for Milwaukee County as a whole. And our 2 strategic area focus where our strategic initiatives director, he will go into this more throughout this presentation, but I wanted to just provide that high level. So for Department of Health and Human Services, we do believe in no wrong door. And the no wrong door approach is really how we realize our vision of creating a healthy community together with the people that we serve, with our stakeholders, with our provider, with the community as a whole. And we are doing this to improve the health outcomes for all Milwaukee County residents as we focus on achieving racial and health equity. And that really, again, helps us move that needle to become the healthiest county in Wisconsin. No wrong door, it helps us create easier access to quality and person-centered care through what it is intentional inclusion, right? So ensuring that there's an improved customer experience, that as people come through our doors, that we're not saying, here are the services that we are just offering, but no, what do we need to wrap those services around the people that we are served, whether that is a child, a young adult, an older adult, a person with different abilities, and meeting people where they are. And that second part is bridging the gap by looking at unique needs of the individual and providing that direct access to those tailored services, giving people what they need to thrive, giving people what they need to be healthy, giving people what they need to be their best selves. And then lastly, the investing in equity with extra funding for the most needed services such as transportation or caregiver support and housing and case management. And even as we think about not just those needs, but even if we talk about isolation and we talk about mental health services, and again, being there for the community when they need us the most. So no wrong door really means how do we serve people across their lifespan, right? With acceptable care that will promote the dignity, regardless of their race, regardless of their age, regardless of their socioeconomic status. And so we are really, you're going to hear more about those two strategies as you see at the bottom from our initiatives director, and really want to hear your input of how do we move that forward. And again, our focus, again, is on the health and racial equity. And, the things that we do to recognize that is to really look at the community disparities that lead to those needs and valuing each individual, as we talked about earlier, valuing each individual as they come through our doors to ensure that they get what they need. So listening to those underlying needs as they come through the door and understanding how do we provide them with either services or get them connected to programs or get them connected to other resources. Sometimes someone just needs help navigating the system because it can be so hard to know city services and programs versus county and what does that look like and what number do I call. So we are here to be those navigators to get people connected and acknowledging and rectifying current policies and practices that will inflict harm. So we really, again, want to promote and really look at the everything that we do, the services we provide, the programs that we have through a racial and a health equity lens. I now want to introduce our Deputy Director, David Mohammed, who will provide a high-level overview of just the services that we have and what we have done to respond during COVID.
Fantastic. Thank you, Director LeGrant McLean, and to all of the administrators and staff, as well as those watching us on YouTube, and I believe we're also on Facebook. We appreciate your questions, and I see some care coordination taking place in the chat already, and that's what we want to see. To speak to the points that had just been raised with regards to DHHS and our major services, as Director LeGrant McLean noted about No Wrong Door, about the goal of care coordination across divisions, and making sure that we're providing person-centered care and services for those who find themselves in need, preferably at the front end, but at every entry point that they might find themselves with regard to the systems and services that we operate in and provide. There are 6 major areas of impact for DHHS. They include children and adults with disabilities and services for those in that category, as well as youth services, aging and adult services, behavioral health, housing, and veteran services. So I'll just briefly cover each of those areas. For our children and adults with disability services, we operate our Disability Resource Center, the Children's Long-Term Support Program, Birth to 3 programs, as well as our COP or Children's Community Options Program and Adult Protective Services. For youth services, of course, this is the youth justice field, and we are the area of support within the Vel Phillips Detention Center and Children's Court. But we also operate community-based diversion and promote peer support and shelter group care through our partnerships internally with Wraparound Milwaukee and the Behavioral Health Division. As we move more towards the front end of care and support, people should expect to see more community-based alternatives rather than the youth detention or placement options. For aging and adult services, this includes the senior centers, the congregate meal sites, transportation, wellness programs, legal benefit services, family caregiving services, as well as those services for those who find themselves in need of assistance with the IDAP program or the burial assistance and energy assistance program. Next slide, please. Now, our next slides deal with the behavioral health, housing, and veterans divisions. For behavioral health, many people have come to rely on us for what is provided at the Behavioral Health Division's complex on Watertown Plank Road. This includes adult and child acute inpatient, our psychiatric crisis services or emergency for those experiencing a psychiatric crisis in the community. We work alongside law enforcement, but also individuals bring their family members or persons in their care to receive care and support at this location, as well as targeted case management, comprehensive community services, and crisis mobile teams, or the CART team that responds whenever there's a law enforcement contact, but clinicians are able to respond and help mitigate any harm that could come from an encounter with a person experiencing psychiatric crisis in law enforcement. We also have our crisis resource centers, and as I mentioned earlier, Wraparound Milwaukee, providing services and support for the holistic kind of needs of children, teens, and adults. Our housing services, we've been able to manage and really reduce precarious housing in the city of Milwaukee and the county by and large in a significant way. We focus on those who are in street homelessness, but also those who are at risk for being homeless. So housing first initiatives, homelessness prevention, and other connections to programs with the city of Milwaukee's block grant, and making sure that we are doing street outreach as well for those with housing vouchers and supportive housing programs. Veteran services, we work alongside obviously the VA and other services and supports that exist for the veteran population, but healthcare aid grants and subsistence aid grants, burial allowance and flags, the GI Bill and tuition waivers, legal clinic, job services, disability claims, and support and home loans for those veterans, as well as education reimbursement and support for their families and survivors' pension as well. I'd like to pivot now and talk about DHHS's response in the last year, given the pandemic, and how we've been able to shift and be responsive to the needs of the community in spite of the pandemic. While many sectors were impacted and might have had to limit services, we were fortunate enough to be nimble and adapt and respond in creative ways to maintain services and support for the residents of Milwaukee County. First, as I mentioned, we continued operations in the COVID environment. We shifted to virtual meetings, phone calls across programs. So even though folks were working from home, there was not a missed beat in terms of being responsive to the needs of the public. We adapted from the congregate meal program to meal delivery, and from in-person programming to wellness checks very quickly. And I would like to shout out the Division on Aging for their ability to do this. In fact, I think there were more meals served during the pandemic in this way than there were in in-person meal sites. We cared for the vulnerably housed, and of course the housing division was able to stand up Clare Hall for COVID isolation for people experiencing symptoms, as well as those who had been testing positive for COVID. And so even though people might have been experiencing precarious housing situations or homelessness, they were able to get the care they need to prevent them from falling through the cracks with COVID-19. And we continued street outreach on a daily basis, as well as the eviction prevention efforts. This was very much a needed service, as we saw the pandemic affect people's bottom lines and their home economics. And through the CARES Act, we were able to do much in the way of supporting families to maintain their housing through this pandemic. Keeping safe of those in our care, that was something that we are tasked with and charged with. And we saw at BHD, as well as for the youth and the facilities and young people in our care, that we were able to prevent any significant spread of the virus within our facilities or within our staff. And so we're very proud of the collective effort that took place there. We cared for our community providers as well, providing thousands of pieces of personal protective equipment for agencies who really make up, as we talk about no wrong door, they are the doors of people accessing services with DHHS, and they stayed operational and were able to receive that at no cost to them because they are an extension of our services and support. And then our support staff transitioning, we maintained operations significantly. And I'll go to the next slide so that we can continue to highlight the work of the Department of Health and Human Services. Our COVID response was one of being able to convene and serve as a backbone for the unified operations to respond to COVID-19. Many of our staff participated in the formation of the Unified Emergency Operations Center, and this has continued through the Community Resilience Response Team meetings and groups that have been facilitated by our staff. I'd like to highlight the work of Steve Godetsky and TJ Cobb on this work as they worked with partners across the public health sectors and our community partners for this response ongoing through the pandemic. We uplifted the community through COVID, and we really focused on a racial equity lens with this to make sure that mutual aid work was being supported by Milwaukee County. So we connected with residents who had a deep understanding of Milwaukee's history and the impact of the pandemic. We know that the pandemic exposed a lot of the cracks in social services and the public sector by and large. And so we were able to maintain a response to that. We awarded over $825,000 to neighborhood and grassroots level efforts that were focused on responding to the effects of COVID-19, direct and indirect. And we saw that also with regards to the rise in situations such as domestic violence and other types of social ills that came up as a result of this pandemic as well. And then messaging with regards to public health and keeping the community safe with the mask distribution and other public health literature. We worked throughout the summer. We saw two pandemics last year, one of violence and one of COVID-19. And so we deployed community-based organizations with the Milwaukee Parks Division for the We Care crew and making sure that our family members who were in the public spaces could take those messages home to protect their families from COVID-19 and encourage social distancing as well as mask wearing and sanitizing and keeping a safe environment. And then there's been continued outreach with regards to our boards and advocacy groups with regards to this. Additionally, there's been a lot in the way of the vaccine and other pieces of information that would reach the community, and that has continued through the UEOC efforts, which DHHS has been a key partner in. Next slide, okay. I'm gonna pass the floor back to Administrator Clark and Director LeGrant. And thank you, and we look forward to your questions and comments.
Thank you to Deputy Director David Mohammed. And so what we'd like to do at this point is allow an opportunity for all of our participants to share some information with us. And so as you just heard Deputy Director, the Deputy Director speak about some of the resources and services that are available, this question is related to access. And so still some people find it hard to connect with DHHS services. What would you suggest be done to improve access? We have seen a few comments already in the chat box, but we'd like you to respond to this prompt. Some people find it hard to connect with DHHS services. What would you suggest be done to improve access? And one of the things that we've heard in the chat so far is accessible housing for people with disabilities is a challenge. Actually, both of the comments that we received so far are related to accessible housing for people with disabilities due to long wait lists and other challenges, making sure that they're also affordable. Are there any other things that you would like us to know about being able to connect with DHHS services and getting access to those services? Thank you. Home improvement help is something that would be useful to individuals in the community. And we know that being able to get modifications or home improvement is one of the ways that community members are able to stay in their homes. So that is something that's very important. Thank you for sharing that.
Minister Clark, if I may, I think one of the things that we've been thinking about so far is that we have a lot of services that might be available, but they may still not be accessible. So there might be a lot of different opportunities and to gain help, but there might be barriers standing in the way of accessing that help. So I think that's what we're trying to get at a little bit is, how do we make services more accessible, or what are some barriers standing in the way?
Thank you for that. So we did receive a question around how we communicate with residents. Do we send out an update? We do have a series of platforms that we're able to share information with residents. Some of them include community conversations such as this. We have, we do have the website that's listed in the chat. We have mailings that are submitted and shared with individuals. We have flyers that have been shared at COVID testing sites. We have outreach workers who go into the community and who have continued to go into the community with, while practicing social distancing. So we have a wide array of strategies to provide information to community members, social media, public education, lots of different things. If there are specific avenues that you would recommend to us, please share those with us, and we'd be very willing to consider those as well to make sure that we are letting people know what's available to them. And so with that being said, I'd like to shift gears and introduce Steve Gordetsky, who is our Strategic Initiatives Director, and he'll be leading the next portion of the presentation.
Thank you, Administrator Clark. Good evening, everyone. My name is Steve Gordetsky. I'm Strategic Initiative Director at Department of Health and Human Services, and I'm excited to spend this time with you, and really appreciative of you taking time out of your day to talk about where DHHS is headed and how we intend to get there, and to give some feedback on kind of what you're seeing and how we might approach it. My role at the department is thinking about where we're going and how we get there together. So just really excited to talk about it, and just humbled to present the thinking of the department on this topic. So we wanted to start with county vision. And the reason county vision is so important is that the work that we are doing is really meant to support what the rest of the county is headed to. And also what's exciting about it is that it is a really ambitious vision. And maybe we can just press forward. And hopefully you've seen this vision in the past, and our county exec has spoken about it quite a bit. And the vision is, by achieving racial equity, Milwaukee is the healthiest county in Wisconsin. What's particularly exciting for me about this vision is that it's really audacious. It's not just speaking about doing better, it's speaking about transformational change for the purposes of health. And when we say health, we really mean this holistic health, not just healthcare and physical health, but also mental health, social well-being. So it's not just the absence of disease. And so when you look at this vision, essentially there are two pieces there. One is racial equity, and one is health. And that really, for the Department of Health and Human Services, puts us at the center of how the county is planning to achieve it. And that means that how we're thinking about the future of the department is truly in the vein of, how do we get to this substantially healthier place? So as we started thinking about how do we become the healthiest county in Wisconsin, we had to ask, where are we starting with? And we have a whole page here on kind of what is the health of Wisconsin. I think, one of the stats that we speak about is, there's a county health rankings where Milwaukee is the 70th out of 72 counties in Wisconsin. But really, if you actually dig deeper into the overall health of the county, it speaks to just incredible disparities by race and ethnicity across our population. And truly, when we looked at this in depth, there was almost no statistic that didn't show this disparity. We picked out a couple here related to mortality, really. So a white person in Milwaukee County will on average live 14 years longer than a Black person. And then on the infant side, the infant mortality rate is almost 3 times higher for our Black residents than for our white residents. And these statistics are, I guess, shocking and unacceptable. And we have a long way to go in terms of moving the needle on this. But again, these are just 2 statistics. Many other statistics can show a similar disparity. And then for us, I think in the past year, and what's been top of mind for residents is COVID-19. And again, I think what we saw in this past year as we've been responding to COVID-19 is a relatively similar theme. So what we know is that early on in COVID-19, those that were primarily affected were our communities of color. And even now, as we look at the totality of the past year, we see that Latinx residents were twice as likely to contract COVID than white residents, and Black, Latinx, and Native American residents were 1.5 or more times more likely to have been hospitalized with COVID. So for us, I think as we were putting together our plans and kind of refreshing them this past year, thinking about the takeaways from COVID and thinking about takeaways from racial justice over the past year, certainly reinforced that this emphasis on disparities and emphasis on racial equity, we need to stay true on. The other thing that reinforced for us is that we couldn't do it alone. And we partnered effectively through COVID, and I'll talk a little bit more about that, but it also is reflected in our strategies. So we're going to get into the kind of department strategy, and Director LeGrant-McLean's kind of previewing that at the top. But first, I just want to spend 1 minute on terms, because I'll use a couple of terms, and I just want to make sure that that's well understood. So I have this diagram here with circles, and it's meant to describe these terms that are on the page: future state, strategies, building blocks, strategic plan. So essentially what we're talking about is that, if we represent the department today as that blue dot on the bottom left corner, we've spent a lot of time thinking about the green dot, which is kind of where do we want to go in 5 years? And that's what we define as the future state. The organization will become in 5 years as the Department of Health and Human Services to move us in this healthier direction. And then the dots in between are essentially, our goals for 1 year, 2 year, 3 year, 4 year, and so on and so forth. And then as we think about that future state, essentially there are these critical concepts or building blocks that we started thinking about from our analysis. And out of those building blocks, we built the strategies of how we'll move in that healthier direction. And then, so we'll talk a lot about that today. And then we've started working on the strategic plan, which is kind of the how of how we get from the blue dot to the green dot. So it feels a little bit academic. So I'm going to try to use a metaphor, an example to kind of describe these concepts. And I'll use one that's close to home for me as a new parent of a 9-month-old. So if me and my family were thinking about what caring for my 9-month-old would look like, and we were considering what we would need, we might consider what types of things are needed for taking care of him, the hours, how much engagement he might be getting, the price, the location. Those might be our building blocks of kind of where we want to take it in terms of caretaking. And then the strategy is, based on those building blocks, we might go with daycare, we might go with nanny, or we might go with a family member. And so the combination of these building blocks and these strategies is kind of what we'll end up doing. And then the strategic plan is more, okay, we've made a decision around the future, how do we get there? So that's a little bit about terms. And now we'll talk about kind of how we got to, these strategies. And I just want to reiterate that as we develop this sort of green dot and where we're going on our goals, we collected a lot of information and insights, and it's really been a continuous conversation and a continuous learning opportunity for us. And even in this past year, we've been spending a lot of time kind of taking lessons learned and incorporating that into strategy, because we truly believe that strategy is not a static thing. You have to continue to learn, and we certainly learned a lot in the past year. So we started with county vision, and that's a vision around racial equity and health. We spent a lot of time with DHHS leaders truly reflecting on what we're doing, and is that moving us in a healthier direction? We did a lot of analysis, and a lot of the analysis was done by the cross-section of volunteer leaders across our department. We collected inputs from the community. We did dozens of community stakeholder conversations and collected inputs from various community sessions across different topics. We did a number of staff sessions across the departments. We looked at surveys from our contracted staff. we looked at surveys and inputs from participants across the department. And then we kind of dug into the data, and we kind of previewed some of the data earlier. What is the state of the health? How do we look at social determinants? What does our own data tell us about where we are and what we might want to change? And then finally looked at national models about kind of what does healthy look like. So this, and then of course today is a great opportunity for another inputs. And again, we look forward to hearing from you around kind of feedback on what's presented today. And this will be a continuous conversation, not just today, but in the future around the department's strategy. So on this next page, I'm going to speak through the building blocks, kind of the key concepts that got us to the strategies. And it's really at the crux of what we learned across all these different elements. And as you might imagine, just like with selecting your childcare for your child, you might have a lot of considerations and thoughts. So there's a lot of them here. Bear with me. I'll walk through them slowly. And one way I'll try to speak about it is to talk about it in the context of not just the concept, but how we took these concepts and applied them through COVID response. And that'll be a reflection on what Deputy Muhammad was talking about. So first, we started with resident health outcomes, and we just spoke about that. And that's really at the foundation of the department's and the county's vision. How do we affect the disparities that we see by race and ethnicity? And then, of course, in our COVID work from the beginning, we were thinking about that. And in partnership with our OEM departments, we looked at our data and we disaggregated it by race and ethnicity from the start, which was showing that disparity. And so we started looking at these health outcomes, and of course that showed that we needed to continue to look at our data and look at our own internal processes around that. So then when we looked at those COVID response as well, it was clear that we needed to break down some of the silos that exist, whether they're internal or external, to get to that, to get to the response. So within what that means for us in our work is that kind of this no wrong door concept that the director spoke about, where no matter where a resident enters or makes contact with us, they're able to receive the care that they need in the way that they want it. And the goal of the department is to then orchestrate the different services. That there might be a number of different needs. How do we orchestrate those for them to make it easy? So with COVID response, what that meant was that a number of our different areas, while their primary work might not be COVID, they were distributing PPE, they were partnering with vaccinators and testing organizations to get those vulnerable residents that we serve to those COVID assets. And there were examples where we were using funds that typically at the housing division to help with food and others. So just a great example of kind of breaking down those silos, and that will continue to be needed as we go beyond COVID. One of the things we also realized really early on is that especially in COVID, it's not fair to ask our staff and our contracted staff to. We know that you can't be compassionate and thoughtful and caring without caring for the staff and the contracted staff that are working with our residents. And so we have this whole theme around healthy staff and community staff. So how do we invest in staff and ecosystem to get the outcomes that we want? In COVID, that means we supported the transition to remote work. We supported staff mental health. We have gave an ability to take hours through life disruptions. We've worked with our vendors to distribute PPE and work through the fiscal challenges. So that definitely came through in COVID response. The second piece, and again, highlighted through COVID response, is this concept of leading major system change. And this was just something that we realized as we did our analysis, that while the Department of Health and Human Services is a major provider of human services and funder of human services across the community, we can't do it by ourselves. And yet, because we're such a large provider, what is our opportunity and maybe obligation to challenge how our systems do their work and maybe catalyze those systems. And in particular, focusing on addressing structural racism and focusing on moving dollars and resources upstream to address prevention and focusing on uplifting community voice. And certainly, we did a lot of that during a COVID response and our work with public health and uplifting community voice in those conversations. And then for ourselves, this next block, not just moving our systems towards prevention, but also just realizing what we must do with our resources. You know, a lot of the history of departments like ours is that we're built as a safety net. And that means a lot of our assets are really on the side of when individuals are in trouble, we help them. But we also know that being able to catch individuals that might be at risk is better for both the individuals, and it's easier for us to help them and move them in the right direction. So we've been thinking about how do we move our own assets upstream as well. So these are elements about what we want to do. And the next 5 are around how we want to do it. So the first one is this concept of participant and the community at the center. And, you know, it really speaks to, you know, how do we orient ourselves and what is, you know, how do we make decisions? So it seems like kind of a smaller concept, but it's really a big deal because we are seeking to change from being program-centric to being participant community-centric. And that means, you know, it really speaks to how decisions are made. Decisions will be driven by not what's effective for participants and community and what's needed by participants and community, and less so by, you know, funding sources or, you know, programmatic elements that might be effective for us. And that's a big shift for us, but a really important one, and certainly one that we followed during COVID as we, you know, thought about, you know, shifting our services to serve participants in need, and you know, shifting from in-person services to virtual ones, and knowing that's perhaps that might not be as easy for, you know, some of our participants, and a community at the center in terms of uplifting community voice and those grassroots providers, you know, during COVID response. The next one is really at the center of the vision for the county and therefore for the department, addressing racial equity and investing in affected communities. So for us, addressing racial equity means addressing racial equity both internally in our policies and practices, and externally in terms of how we affect our community and how we provide services. So a lot of work there, and truly cuts across all the different other boxes. And the second piece around investment in affected communities was our realization that the Department of Health and Human Services gives out more than $200 million in contracts every year to community organizations. And we asked ourselves, what does that mean in terms of our ability to invest in the communities that are affected, and affect, you know, some of the economics of those communities. The next one is around root causes and social determinants. I think just recognizing, and a little bit around no wrong door, that we must not only affect and take care of the needs that are in front of us or in front of the individual that we serve, but think about kind of what caused those needs. And a lot of times what cause those needs have something to do with social determinants, whether it's housing, whether it's food, whether it's transportation, schools, jobs. And while we don't have many of those social determinants as a division of our department, we do have some of those elements that implies a lot of partnership for us. And certainly we did that during COVID response in terms of partnering with public health, partnering on food, partnering on housing and other elements. This next one is one that we actually thought a lot about over the past year. You know, this partnership that I just spoke about around social determinants, it can't take place without trust. And we spent a lot of time thinking about how do we grow trust between us and other organizations, between leadership and staff, between us and the community, between us and those we provide services to. And this concept of developing trust is really important one. We spent a lot of time on COVID response, and certainly continue to do it as we think about vaccine rollout. And one we'll talk about a little bit a little bit later. And then finally, the resources, just recognizing that, we have this ambitious vision for the departments, which means we want to do a lot more prevention. We want to do a lot around social determinants, and that means we need more resources to be able to do that, and asking ourselves, how do we intentionally develop more resources and apply them? And certainly we did that a lot in COVID response and partnering with philanthropy on social determinants and partnering with other organizations like academia to do that. So this was a lot. I'll let these 9 boxes sink in, and maybe I'll just say that there's a lot of them because we really asked this deep question: how do we as a department move the needle on health? And there is no simple answers there. So that's why we have this many elements that we think all of them are needed to be part of the answer on moving the needle on health. So we took all these elements, and there's a lot of them, and we said, well, so what? What does that mean? What does that mean in terms of what we do? And just like in selecting whether you want daycare or want to work with your family or work with others, you take all these elements and you still need to know kind of what does that all lead you. And for us, that led us to 2 kind of major strategies. And the director, Shakita LeGrant-McLean, spoke through these briefly, but these 2 major strategies kind of add up all those building blocks into 2 elements. So the first one is around no wrong door and integrated care. This one is really thinking about how do we serve the individuals that are in our care or seek our care in the best way possible. So the focus here is centering individuals and families that we serve. So the question is, how do we orchestrate care for them across the age continuum? How do we get to yes on addressing their needs, no matter where they enter, and no matter kind of what the programmatic elements are internally? How do we address root causes, and how do we address racial equity in our policies, practices, and contracting? So this one is about how do we do the best for those that we serve. And the second one is around collective health. So this one is more about how do we look at whole populations and move the needle on health for those. And here it's more about leading, catalyzing human service systems to address structural racism and prevention, move our own assets to prevention. How do we influence funders, and how do we amplify community voice? And so you look at these, and it's interesting because they're quite different from each other, but I'd say that they're complementary, and both are necessary and insufficient without the other. And just to use an example to speak about that, maybe I'll use housing as an example. A lot of our work early on in housing focused on individuals experiencing homelessness or precariously housed. And that implies doing work not just with housing navigation, but also with behavioral health, with food, with other social determinants. And we must be excellent at doing that in terms of navigating those in most need and precariously housed. And we also know that if we do the best that we can to take care of those individuals without changing what creates those needs, without changing what has created that precarious housing situation, we know that the following year, after we took care of those that are in front of us, there will be more individuals who are precariously housed with the same level of need. And by the way, a lot of those needs, will continue to be stratified by race. So we both must focus on taking care of individuals in front of us and thinking about how do we change the systems to change who and how much need is there. So that's the end of the presentation. I spoke a lot here. We spoke about these building blocks. We spoke about these broad strategies. And so we'll do a little bit of feedback. So we're going to talk, we're going to do a quick survey and we'll pull up a couple of questions. And we're hoping that each of you on Zoom can reply to this survey and then we'll look at survey results. So the first one is around the first two are around building blocks and which ones are important. So let's pull them up. So the first question is, which building block, and remember I spoke through 9 of them, and they're all listed here, which building blocks are the most important for you and your family? So we'll talk in the next question about for the community, but as you think about you and your family, which ones, and you can select a couple, which ones are the most important to you? So we'll give it maybe 15, 20 seconds for folks to select these, and then we'll share the results and speak about them for a minute. I can't tell how many have participated, but hoping each of you can participate, and we'll just pull up the results in just a couple of seconds here. Jesse, should we pull up the results? All right. So thanks. My hope is that each of you can see the results. I'll just try to summarize. Each of the building blocks got a thumbs up, which is great to hear. So each of them got some responses, and at the top maybe 3 are addressing root causes and social determinants, developing trust, and then participants and community at the center. So that's great to know, and certainly for us, because there are so many building blocks, it's always good to get a feel for kind of emphasis and where we should be putting a lot of time. And I'll say that this element of social determinants is one we spent a lot of time on, especially in this past year, and appreciate the element around trust, and we'll talk a little bit more about that in a minute. So the second question is more about the health of the community. So as we look at, again, the same answers, the same building blocks, which building blocks hold the most promise to making Milwaukee County the healthiest county? And that's the vision for the county to become the healthiest county in Wisconsin. So of these 9 that we spoke about, those building blocks, again, not for you and your family, but for the community as a whole, which of these 9 hold the most promise? So again, we'll give it 15, 20 seconds for folks to respond, and then we'll pull up the results. And just appreciating folks responding. Again, we've spent a lot of time thinking about that internally, so it's helpful to get some outside voices on this as we consider how to push it along and what to emphasize over the next year or the next several years. All right, should we pull up the results? Okay, so again, most of the building blocks received some responses, and actually, some similarities to the question before around you and your family, but some differences. So again, the top one is the same one as before, which is addressing root causes and social determinants. And then the next couple, addressing racial equity, investment in effective communities. And then again, participants and community at the center, which was relatively high in the list last time as well. So, hearing a theme around social determinants, and then this element of racial and participants and community at the center, and then this racial equity, investment in effective communities kind of popping up more as we think about moving the needle on healthiest county. Thank you for that. So then we have 2 more questions, and these 2 questions are more around these broad strategies rather than the kind of the 9 building blocks. So the first one is a 1 to 5 scale. So again, 1 being strongly disagree and 5 being strongly agree. So the statements that you agree or disagree with is, I think orchestrating services for improved access, and to prevent problems in the first place will help to move Milwaukee County in a healthier direction. So orchestrating services for improved access and preventing problems in the first place will move the county in the healthier direction, 1 through 5, 1 being strongly disagree and 5 being strongly agree. So give it a couple of seconds for folks to respond. All right, should we pull up the results? Okay, so we got a range. We got some 1s and we got a bunch of 5s. So 47% of you who responded gave it a 5 and in a strongly agree, and I think majority, 88%, gave it a 3 and above. And then we did get a 1. I strongly disagree on this question, so certainly would love to hear in the chat if you're comfortable, kind of any comments if you strongly disagree or kind of moderately agree, and we'll certainly have more opportunity for discussion on this. Thank you for that. And then the second question is really around that second strategy. Again, 1 to 5 scale, with 1 being strongly disagree and 5 being strongly agree. Then the statement is, I think moving human service systems to address structural racism, to invest in prevention, and to uplift community voice will help Milwaukee County move in a healthier direction. So again, moving human service systems to address structural racism, investing in prevention, uplifting community voice will help Milwaukee County move in a healthier direction, 1 to 5 scale, 1 being strongly disagree and 5 being strongly agree. So we'll give it just a moment. All right, so we'll pull up the poll results. Okay, so again, got a number of responses. Thank you. And we got 60% of respondents marked at a 5, being strongly agree, and all 100% of the responses gave it a 3+. So appreciate that. So thank you. This is really helpful. We'll review these results, and again, I think looking for more opportunity to get a little color commentary on these in the Q&A. And then I'll hand it back over to Administrator Clark, and I think we wanted to get a little bit of discussion on this question of trust, which was highly rated in our survey here.
Before we go on to the question of trust, I would like to take a moment for Administrator James Matthew, who's on the call, to respond to a question we received in the chat box on housing. So we received a few questions on housing. The first was related to housing options for people with disabilities, and another one was related to housing resources and services that we have, specifically on home repair. So Administrator Matthew, would you mind responding or sharing some information about those questions that we received?
Yeah, sure. Thank you, Smaya. Thank you for the question, whoever submitted those two. So to start with our home repair program, we do offer an emergency home repair program. The one complication, the city of Milwaukee also runs a similar program. The funds we get from HUD can only be used in our suburban jurisdictions because the city of Milwaukee does run their own program. So we do 0% interest loans for low to moderate income homeowners in our municipalities. And that can be anywhere from plumbing, electrical, roofs, all those types of things. And we can do 0% interest loans and spread those out for a very, very long period of time, sometimes up to 20 to 25 years even for those that really need to make minimal monthly payments. The other thing that we offer in the home repair program is we work with the homeowner to get multiple bids and kind of help homeowners work through that process with various contractors. We have preferred contractors that we've already vetted to assist homeowners with that. And the other important thing that we're able to do with our inspectors is we ensure that all the homes that we work on are lead safe. So we also do lead testing. So if we find lead in the windows or siding or those different types of things, we're able to do that lead remediation as a grant instead of a loan. So those are totally forgivable grants. So it's a popular program. So that's what we're offering for a home repair. We might be able to expand that program with the latest bout of stimulus dollars as well. So stay tuned for that. As far as for housing for people with disabilities, it depends on HUD guidelines and what those disabilities are. So we have several HUD grants that are focused specifically for individuals with a mental health diagnosis. So behavioral health division, consumers, individuals that specifically qualify for our HUD rent assistance program. We have about 600 vouchers specifically for that population in our program. We also have newer partnerships, especially our Disability Services Division, where we share staff and we work directly with the Disability Resource Center to assist households directly that are being referred from the Disability Resource Center. And post-COVID, when our offices open back up, we'll be able to have a staff person literally embedded in that program. So hopefully that answers those questions.
Thank you so much for that.
Thank you.
And so before we shift to the last question around trust, I believe Cleopatra Eccles is on the call as well. Would you mind sharing some of the resources that we have available for individuals or families who might be having difficulty heating their homes or paying for utilities?
Yes, thank you, Administrator Clark. My name is Cleopatra Eccles from the Milwaukee County Energy Assistance Program. The Energy Assistance Program is a one-time benefit payment available to Milwaukee County residents age 18 and over. It's for anybody that qualifies by income. Our income guidelines are at our website, keepwarmmke.org. And it's a very solid program when you think about income. Years ago, people would think it was only for individuals with very, very low income, but you can still make a really good wage and still qualify for this program. It goes by your family size and your income. So for example, a household of 4 can make over $4,500 a month and still qualify for this program. The way you apply is by scheduling an appointment with us, either by calling 211 in scheduling or going right to our website at keepwarmmke.org and scheduling your appointment that way. We also have an online portal where individuals can skip the line and just go ahead and do their application online. And after the application is processed within about 7 to 14 business days, they'll get a call or a letter informing of their benefit status, or if more information is needed, a request back for that. This is so important right now because a winter moratorium ended today. That means We Energies can officially, legally start sending out disconnection notice to those who may be behind on their utility bill. Our heating season ends May 15th, so we can only actually process applications for those people who contact us before that date to get that regular benefit, which can be from $200 to $1,000 for a one-time benefit, depending on your household size and usage. In addition to getting a regular benefit, qualifying for energy assistance also gets an applicant able to get additional funds like crisis funds. So in addition to that $300 maybe regular benefit, they can get an additional $400 to $600 for crisis. And then I know someone was asking in the comments about help with home repair. We also connect them to our weatherization program, which is the third benefit of our program, that they come in and they do furnace repair and replacement absolutely free. They can change out insulation, they can do thermostat repairs, a lot of things to make your home more energy efficient and bring those costs down on a regular basis. It's all free for Milwaukee County residents that qualify by being income eligible. So again, to reach out for that program, you go to keepwarmmke.org, or you can call 211 to schedule. They're open 24 hours, 7 days a week. A lot of people are familiar with our 270-4653 number to call, and you can still call that number. I just want to warn you guys, we are experiencing very high volumes of calls right now. So the fastest way to get to us is by calling 211 if you don't want to leave a message and wait that 48 hours for a call back.
Thank you so much for sharing that. And then the last administrator that I'd like to share is Rick Flowers, who's the Director of Veteran Services. There's also resources that they're able to provide to support veterans, many of whom may have disabilities or other challenges. So yeah, they do have services available regarding housing as well. Rick, would you mind sharing some of the information, Director Flowers?
Sure. Yeah, so if for veterans who are possibly facing eviction or need help with energy as well, we are able to provide one-time assistance with eviction processes, or if a veteran is forced to move in emergency and need help with a security deposit, we're able to assist with security deposits. We're also able to help with veterans who are facing energy crisis as well. Even if they do get energy assistance, they still can come to our program as well and get some assistance with their energy if they have a disconnection notice or their energy has already been disconnected. They can connect with us as well. And we also partner with another agency that helps veterans with these issues as well. It's called Heat for Heroes. And so we kind of put together packages to ensure veterans can get their energy reconnected or kept on, or keep a veteran inside of their residence. So we have those programs as well.
Thank you so much for that, Director Flowers.
You're welcome.
And the individuals who posted those questions, unfortunately, you're not alone. You know, we've not only seen a lot of people in Milwaukee who are experiencing difficulties with housing, but it's something that's a nationwide crisis. And so we are, working very hard to make sure that we can provide resources and we can make sure that you and your neighbors are aware of the resources that are available. So thank you so much for expressing those concerns and asking for those additional resources. And so now I'd like to go back to script and talk a little bit about trust. So in addition to hearing about the programs and services that we offer, are there other things that are related to developing or cultivating a sense of trust? And so we know that developing trust is important in terms of advancing the strategic goals and the strategic direction of DHHS, but it's also important in terms of, like who you may engage with that might be a caregiver or a case manager. Trust is important at all different levels. And so if you would be open to sharing with us, what are some of your ideas about how DHHS can improve trust with participants or the people that we serve, our partners, and residents at large? What are some ways that DHHS can improve trust with participants and the people that are served, partners, and residents at large?
I know this is a tough one because trust is a complex thing. But hoping we can get some of your thoughts, because we know that trust will be needed as we think about system change, but also trust will be needed and will continue to be needed as we work with participants across the community, and will make us more accessible as well. So certainly curious, again, either trust in the department or trust in the department will help, or trust in government as a whole. I think we're kind of thinking about that from all these different elements.
We did actually get a comment as well. And the comment related to that says, keep doing programs such as this one, letting us know what's up and how we're accomplishing the goals. So that's one of the things that we'd like to do, not just get information from the individuals who are participating, but coming back to say, hey, here's what we heard. Here are the next steps that we'd like to take as we move forward. Are we getting it right? Because that's important. And that's one of the ways that we'll need to approach this work as we're becoming more community centric, or putting the voices of people who we're providing care for at the center of our decisions. There's a few other things that we got. One says, trust is built by continued follow through of a successful outcome. So sustainability, that may go back into the concept of reinvesting, this reinvestment and revisiting what we're doing and sharing. When there is constant revolving door of new people and workers, it makes it difficult to trust people. So that's something, working on our internal practices so that we can have staff who feel more satisfied, and they're able to stay in their positions longer, and they have the resources to show up well for the people that we serve. Appreciate that one. That's important. And I'm just looking, I think there's a couple other ones. Let's see, I just want to make sure that I didn't leave anyone's comment out. Last one, staff who feel valued. Let's see here. Staff who feel valued and trusted in turn put an effort to build trust with those served. Another one. Let's see here. Okay, so it's not related to trust, but there was a question that was posted. So I'd like to go ahead and read that. And so the question that was posted says, when the 5 senior centers reopen, has there been any discussion to consider having intergenerational programs and activities? Older adults, youth, and families can all learn and benefit from one another. We did get a response from the director of the Aging Division, but John Janowski, would you mind sharing that response that you gave in the chat verbally with everyone?
Sure. Thanks, Samaya, and thanks, Tom, for the question. Again, John Janowski, Interim Director for the DHHS Division on Aging. So to your question, we have been working with our vendor to submit a reopening plan for the 5 county-owned senior centers. We've submitted that plan to the county's reopening steering committee, and we're in the process of reviewing that plan. There's still some additional questions and clarifications needed in the plan, but we're, I guess, cautiously hopeful and cautiously optimistic that we will be able to reopen the senior centers sometime in the near future. There's a lot of variables that could change that equation, but we're hopeful. And in terms of your other question, yes, we do have a program that connects older adults and youth. It's called Connecting Our Generations. We established it about 4 years ago, and we actually expanded it during the pandemic last year, and we're hoping to expand it again this year. And the partnership involves seniors from our senior centers and youth through Milwaukee Public Schools. So we'd be happy to get you more information about that if you'd like. Thank you.
Thank you for that. Well, we really appreciate all of the feedback and participation that we've gotten. Are there any other questions or concerns that you would be interested in sharing with us?
Administrator Clark, I just want to lift up, I think there's a couple of more comments, but I want to lift up one comment around the successful outcomes. So I think that, part of trust is, coming back to you and talking about what we spoke about last time and how we're making progress towards it, or how we're tweaking it based on your feedback. So I think one of our commitments to you is that, this is certainly one of many conversations, not just on this topic, but on continued conversation on this topic as, we continue to make progress towards the future that we want to make and continue to show results around that. So we'll certainly have success measures and outcomes that we want to share. So, thank you for that one. And I think, Administrator Clark, there was a question around sidewalks as well.
Oh, who do you call for sidewalk care? I believe it depends on that, would most likely be the city of Milwaukee, but we can provide the city of Milwaukee information line in the chat box as well. That can be a challenge, and that goes back. Oh, go ahead.
Oh, I'm sorry, Administrator Clark. I've got the number for the city of Milwaukee. I will put that in that chat for the resident that asked. So I'll take care of that right now.
Thank you so much.
That would definitely be a Department of Neighborhood Services, DPW task, but good looking out for that, Jim.
Mm-hmm. And that's important. Even my own, I'll just personal experience. My own daughter is in a wheelchair, and so I can understand how challenges with the sidewalk can be difficult taking, walks with her and the bumps and those sorts of things. So I understand the importance of that question. We did get
Mr.
another
Clark,
comment. Oh, go ahead. I'm sorry.
Yeah, this last comment around phone number materials, I think it just speaks really well to, as we think about that accessibility question that we asked maybe 20, 30 minutes ago, that different individuals might have different needs in terms of how they'll communicate with us. So this question around seniors, we've been very cognizant of that, through COVID response, recognizing that, video calls and online forums may not work for our older population, and frankly, for a number of different populations. So I think that's great feedback. But then earlier on in the chat, there was a question about does the department have an app, which is almost like the flip side of it. So different population and accessibility. And I think that Cleopatra spoke a little bit about kind of online forums when it comes to energy assistance. And we are certainly thinking more about kind of putting more of our customer-facing tools out there, such that while we have a phone number and we have great call centers across our department, also if you don't want to call us, how do we make it possible for you to just do things online? So I appreciate both those comments.
Well, if we don't have any additional questions or comments, I think we can shift back to Director LeGrant McLean to close the program.
Thank you so much, Administrator Clark and Director Gordeskis, for really helping us navigate through this presentation and getting input about our strategic plan. We want to thank you all for participating. Again, it is important that we have you at the table and we hear your voice. We will have this session on our social media so that you can go back and you can watch this later on, or you can share it. Also, our communications manager, she added a PDF to the chat earlier that has all of the numbers for all of our divisions across our websites and how to get in contact with them. But our partner 211 has been so helpful because it's an easy number to remember and they can get you connected to all of the services and programs across Department of Health and Human Services. We really just thank you for taking the time to meet with us today. We thank you for your input. We thank you for sharing your stories and giving us, telling us about what your needs are and what you find important about our strategic plan. We will be transparent and hope that you would see that feedback as you view the documents as we release them later on in the summer. Next week, same time, next Thursday at the same time, we will have a discussion about our budget priorities for 2022. And we hope you can join us, share it with others. We'll share what our priorities are, and we want to hear from you what those priorities should be as well. So please join us next week, and I hope you all have a great evening. Thank you so much for joining us.